Hello, my name's Rick Caesar, and if you're thinking of having any surgery to your eyelids, we can only operate on you with your permission. And giving us your permission involves something called informed consent. And informed consent means that you understand the risks and benefits of the surgery, and that it's explained to you without jargon, and that the significance of those risks is explained to you, such that you are then in a position to decide whether or not you would like to proceed with your eyelid surgery. Essentially, the eyelids are a wonderful bit of the body to operate on because they have a fantastic blood supply and they heal really, really well. So the vast majority of the surgery that we do on eyelids, we expect really nice results. So, unfortunately, we need to tell you about the risks of surgery. So certain things are simply completely normal, and that's that if we operate on your eyelids in any way, as soon as we make any cut, chances are you're going to get a bruise, sometimes a completely black eye. Now this isn't even really a risk, this is simply normal, and the swelling that you would associate with surgery is also normal, as is a certain amount of itchy, gritty discomfort. So bruising, swelling and a little bit of discomfort, I wouldn't even consider a risk, I would consider it expected. The risks of surgery, however, are infection. So whenever you make a cut, there is a possibility that the wound can become infected. A very large bruise with effectively a blood clot underneath the surface. This is called a hematoma, but basically it's a bruise where the blood clot needs draining. That's a second risk from any eyelid surgery. And then of course, if you're cutting the skin, there is the risk of the scar being visible for longer than you were expecting to see it. Now obviously, if you have any cut to the skin, you would always get a scar, but we try very hard in eyelid surgery to position the wounds such that you get the least possible scar. So, infection, bruise, scar. There is the possibility that you get a watery eye for a period of time, and this is because when we operate on your eyelids, we cause them to be inflamed, and when they're inflamed, they sometimes release less of the oil that's essential for your tears, and because you don't have enough oil then on your eye, you get what we call a dry eye, and a dry eye, crazily, often causes your eye to water. So any eyelid surgery can give you a watery eye. And then the last significant risk is, again, any eyelid surgery can risk your vision. And this is simply a nature of the function of the eyelids and of course a nature of the surgery coming close to your eye. This really is an incredibly low risk, but we are obliged to inform you of its possibility. With respect to eyelid surgery, you always have the option of not having the surgery, but if we're operating for a skin cancer, we would explain to you that by not operating, the skin cancer is going to enlarge and progress, and that therefore we think that we would recommend surgery, but you always have the choice of not having surgery. And with respect to anaesthetic techniques for eyelid surgery, you can have a general anaesthetic, but that's often slightly less good for your overall physical health. And we nearly always perform eyelid surgery with local anaesthetic. Local anaesthetic injections are very safe, but they can in themselves also cause some inflammation and some bruising, and of course the injection is slightly painful. So in summary, eyelid surgery is one of the safest areas on the body to have any surgery. Your operation will normally heal extremely well. Swelling bruising, some inflammation and some discomfort initially are all completely normal and to be expected, but will improve. But the key risks to be aware of are infection, needing antibiotics, a very large bruise that might need drainage, a scar which is more prominent than you're expecting, a watery eye, and a theoretical risk to your vision. Thank you.